I'm Bill Trick, your host for Inspired to Heal. In Season 1, I interviewed healthcare colleagues from Cook County Hospital. It was enlightening to hear their wisdom and humanity distilled from hundreds of years of collective healthcare practice. In this episode, you will hear the compilation of their answers to my question: if you could choose one item to put into your medical bag, literal or figurative, what would it be? Bob Weinstein, infectious diseases physician and former chair of the Department of Medicine. His episode was Leadership with Laughter, Triple Threat Doctor.
Yes, I've heard you ask that on some of the other podcasts that you've done. I've listened to. And by the way, your podcasts are really terrific.
Thank you.
I think it's skepticism. Don't believe what you read or hear. Figure out things on your own. Be very skeptical. I remember once an intern, when we were rounding, I asked what a lab result was, and he said it was negative. And I said, there's no way that this lab result is going to be negative or normal, whatever the wording was. And we pulled up the electronic medical record and looked at the report. And the report said, usual outcome or something like that, expected outcome negative. And then in print underneath that, when you scroll down, it gave the result that this patient actually had, which was not negative, but very abnormal. So I think you have to have a really healthy dose of skepticism. Is there anything else that I've said in the past that you think I would have put in my bag?
Wow, I didn't think about
Since
it.
you know me so well.
Let's see. Well, you probably would have a book of jokes and adages. David Goldberg, general medicine physician and leader of the preventive medicine program, who after retirement worked with the Indian Health Service in Chinle, Arizona. His episode was Chicago to Chinle, a journey from urban to tribal health justice.
Boy, Bill, this one really got me stuck. Let me just say, stay curious. There are times where we do this work and we get tired and we feel down or feel maybe hopeless or ineffective or even sometimes bad about a mistake we made. I think that if I could open my bag and pull out a sense of curiosity and have it animate me, I would probably be more patient, more forward-looking, more thoughtful, because there's so much that patients tell us in between the words, and if you're curious, you catch it. I think that also curiosity can drive us to ask other questions, to think, read, learn, ask, consider. So I'll say curiosity.
Jen Smith, general medicine physician, former chair of the Division of General Medicine, and leader of the health system's substance use treatment programs. Her episode was Treating Addiction, Compassion Meets Courage.
I have two, actually. So if I had to pick one in my black bag, it's...
I'll let you say two.
Okay. Well, okay. It's a journal of daily gratitudes. At the end of the day, write a gratitude. Something you're grateful for. There's many things that we can be grateful for, right? But you have to identify them, and they are sustaining. And being a clinician of any kind, these days, certainly being a primary care clinician, it takes a lot to sustain. So identifying your daily gratitude, things you're grateful for. And then, but the big thing is find a colleague. Maybe you can find more than one colleague, but find a colleague who helps sustain your hope and optimism.
Ben Emba, hospital medicine physician and leader of one of the firms of the internal medicine residency training program. His episodes were Teaching Thinking, a master educator's methods, and Deep Roots of Inclusion and Caring for Family.
Being a Nigerian negotiator, can I ask for two?
You wouldn't be the first. I've had other negotiators.
Oh, good. You've had other diverse negotiators. Okay, so if I could put conceptually into my medical bag, one would be humility. Humility would be to make sure that in that bag I have the memories and the lessons from things that I did not get right, and also the acknowledgement that the same disease can present in so many different ways. So I would need humility driven by lessons learned will be in one side of the bag. And then it's almost like a oxymoron, right? I want humility in the bag, but I also want awe, AWE. The awe that's in the bag is the awe that is driven by the depth and the capability of the mind, and how the mind in reasoning clinically can self learn and self correct is just phenomenal. So I'll take humility and awe.
David Schwartz, former chairman of the Division of Infectious Diseases. Dave's episode was Cook County Hospital's Past and Present, a Candid Conversation.
In the current context of where clinical medicine has changed so much, it's become so difficult to find the kind of work that allows the positive aspects of doing clinical care, really the miraculously wonderful parts of it, the renewed sense of the incredible rewards of compassionate and effective patient care. The learning that one engages in is fascinating. It's an iterative process where you get better at it as you do it. You learn all the time if it's done well and effectively, and you continually get a stronger sense that you're going to be a better help to those that you're working with, and that you also engage in relations with patients that is unique. It's a kind of intimacy that comes from close collaboration with another person to address problems of such great import and often of urgency.
Chris Acup, general medicine physician and leader of the internal medicine residency training program, and sometimes drummer in the resident rock band. Her episode was Beats and Balance, the Rhythm of Effective Leadership.
I think I mentioned it. It's that perspective that you have to give yourself at that critical juncture, which is ask yourself that question. If this patient in front of me is my mother or my father, what would you do?
Peter Clark, followed by Chris Smith, both internal medicine physicians and educators leading the firms in the internal medicine residency program. Their episode was Marcus Welby to Smartphones.
Okay, Bill, I've heard the podcast and I pretty much know people are getting to pick two. So I'm going to pick two, and one is very tangible and one is very figurative. So I'll take one of each in my doctor bag. Actually, they're both very trite and kind of boring, but they have the advantage of being the honest truth of what I think. For the tangible one, I'd say what you need as a doctor nowadays is one piece of equipment to be successful, and it ain't a stethoscope, it's your smartphone. And you do everything with this now. You get your medical facts, you have a translator, you take a picture of a skin rash and you send it on. You contact a specialist using it. You check your calendar for rounds. It's everything that you need to care for patients. I remember we were doing a grand rounds presentation one time, and it was about having missed an MR, wide open MR, murmur, or whatever, and the stethoscope, and should we just be going with the hand-carried ultrasound? And I thought, what is the dumbest thing that doctors never use anymore? I said, what is? It's that mirror. Remember that round mirror that goes on your forehead? And what is that thing for anyway? But I remember training with my medical student days. That mirror was for reflecting a light source onto the laryngoscope mirror so you could see the vocal cords. And we didn't have fiber optics back in my day. We had the mirror. And so I tried to look up, can I get a picture just to show the mirror? And I think there was one of Marcus Welby from the 70s TV, but the most recent one I could find that was best was actually just a Halloween costume. That's just how absolutely defunct it is. And so you wonder, right now it's the smartphone, but in another 10 years, it'll be something different. So that's really my tangible one. And my ethereal one is to pack your integrity in any career you go into. You will be ethically and morally challenged. And how you meet that challenge is the measure of your success in your career, in my opinion. And so you need that more than anything. And you would think doing the kind of work we do, it's very humanistic. And, that's true. But on the other hand, I think there's so much at stake that when you go wrong in that realm, there's no turning back. So those are the two things I'd bring.
So I have to agree with the practical thing, the smartphone. I think we'd be lost without that. But I think the thing that I would pack is the ability to be flexible and to change your mind, right? And I think that's something I definitely learned at County, to be humble enough to change your mind, knowing when you're wrong and to be gracious about that and just be flexible in your thinking, to me is one of the things that I have tried to teach people with their clinical reasoning and medical care and treatment, and it's served me really well in my career.
Toyin Falusi and Waffer, infectious diseases physician and former director of clinical services for HIV care at the Core Center in the Cook County Hospital System. Her episode was Women Healing Women with HIV or AIDS.
I would say it would be like an advocacy thing. Every time you're navigating as a healthcare provider, as a physician, in my case, you're an advocate for the person. And advocacy means speaking up for the right thing. Advocacy means going beyond your job description to get things done. Sometimes advocacy means just sitting with a patient and listening, because listening and getting their stories, you may not be able to actually address whatever that pain point is that moment, but that ability to listen and get their stories enables you and empowers you in whatever space you need to be next to do what you need to do. So it's a thing that says your voice matters, which means empowering your patients to advocate for themselves.
Brian Lucas, hospital medicine physician and founder of the Hospital Medicine Program. His episode was Academics Advance Mission.
I have a couple of cheeky responses. One would be just a tie, which I'm wearing because I think it gives me a couple of IQ points. I spend a lot of time now teaching epidemiology and biostatistics at the Dartmouth Institute, and I'm in the middle of this course that I teach in the fall. I'm a big proponent of this concept of taking information, prior information, and then trying to figure out the power of the thing you're doing, be it a diagnostic test or whatever, and then coming up with a posterior probability. And that's encapsulated in this Bayes theorem, right? Mm-hmm. And so theoretically, I'd bring the Bayes theorem, put it in the doctor's bag, meaning that if you look at the Bayes theorem, there's two components of it: your prior beliefs and then the strength of the test. Most tests in medicine, they're not that strong. People don't like to hear that, but it's true. It's incredibly important in that formula is not the strength of the test. Most important is your so-called prior probability. That comes from being a really good doctor. That comes from generating a really solid understanding of how to interpret symptoms, physical exam findings, just having the experience of seeing a lot of patients who are coming in with a similar sort of problem. Knowing that it's not just about ordering a bunch of tests and seeing what the results are, but it's about being a good clinician at the bedside. That is an important thing that I'd always want to keep in my doctor's bag.
Mary Driscoll, Director of Nursing for the Ambulatory Clinics and former Chief, Division of Patient Safety and Quality at the Illinois Department of Public Health. Her episode was titled Weaving Community into Healthcare.
I would put compassion and empathy. Can I put those two? They're two kind of the same.
Yes.
I would put those in my medical bag.
Jeff Shader, former chairman of the emergency department at Cook County Hospital. Jeff's episode was titled Running Toward Chaos, Emergency Medicine.
And I think most people back in the day, they think of a doctor's bag as the black bag where you'd have your hammer, you'd have your stethoscope, you might have your tuning fork and things like that. For me at this point in time, the one thing that I would put in my bag would essentially something that would give me the knowledge on how to treat all the different diseases. And I've become fairly tech savvy. So I would make certain that I have my iPhone with all my important apps in there so I could pull information rapidly about patients in order to actually care for them. Something that allows me to easily access information so I could give the most up-to-date care for the patients and most rapid care for the patients. That's what I would always have in my bag, but I usually carry it around in my pocket, obviously.
One other person gave me that response, and it was your classmate, Peter.
Oh, is that right?
Peter
Interesting,
Clark.
Interesting. Yeah, well, there's a good Northwestern education for you.
That's right, yeah.
I've learned that as being the critical thing. Things are changing so rapidly that it's really nice to you want to give the best and most up-to-date care. It's hard to remember everything because you can't possibly do that. You just have to be able to learn how to access the resources.
And I might slip some Tylenol in your bag for you.
I think the residents were always saying you have to get some lithium because I was always so hyper during my shifts. But so if you ask them that question, they'd probably give you a slightly different response.
Yeah. Kathy Diamant, general medicine physician, founder of the palliative care program at Cook County Hospital. Kathy's episode was Creating a Palliative Care Program.
This is easy for me because in the old Cook County Hospital, there were no chairs. And I went to Target, bought a small little folding chair, and when I started consults, I carried that chair around the old hospital, kept it in the new hospital. I cannot stress enough the importance of sitting down when talking with patients and families.
Keiki Hinami, general medicine physician and researcher. Keiki was a guest with Christine Haley on the episode Healing When Unhoused, Creating a Medical Respite Center.
I'm going to say values. A lot of what we've discussed today is about generating numbers. Let's say quality adjusted cost effectiveness for supportive stable housing intervention or for the medical respite program. In the end, I think these numbers can meaningfully update our understanding of the health and housing interventions only if we allow it to. And it's only in folks who hold certain values that updating of our thinking is possible. To state it conversely, the hearts and minds of people without these values, I think, probably can't be changed by numbers. There are several ways to articulate the values that I'm talking about, but my favorite one might be the recognition that human being is the locus of all of our values. And so to turn our backs to the suffering person is to turn away from the very value that require us to treat human beings as ends unto themselves and never as means to another end. I think the work that we've just started to do, tackling what seems to be an intractable social problem, I think is motivated, at least by me, in my intolerance of senseless suffering.
Christine Haley, social worker and director of housing for Cook County Hospital.
If I had a health bag, I would have keys to an apartment for everyone who needed it. I just believe very deeply that housing is a human right, which means really that cost should be not the primary driver of why we should all have the ability to live in a home. Our homes protect us from the elements. They are a place where we can store our medications. Our homes provide a place for us to shower, to take care of our skin. Our homes keep us healthy. All of us should have a safe and affordable place to call home.
Dr. Jack Raba, physician and medical director at Cook County Jail. Jack's episodes were Cook County Jail, Patients, Public Health and Prevention, and Healthcare Behind Bars at Cook County Jail.
I would focus now about the judicial system. And it's amazing to me that after many of us at Cook County Jail have advocated verbally, maybe not so politically as we should have, but every forum we ever spoke at, we talked about two things. And I got the lecture to high school kids, and I get the lecture to lots of people who want to know about the jail, docs and nurses here or there, or other entities. The cash bond was so evident that every time I spoke, I would tell a story. I'd have a male stand up and a female, and I'm saying, you both are at a bar, and somebody insults you or aggressively hits you or does something, and you hit him back, and it gets to be a big scuffle, and both of you get arrested. Maybe you're the accused to be the provocateur, and you go to the police lockup, and let's say it's Jane. I said, Jane, you're rich. It's a $300, $500 bond. And your family will come up with it, or you could come up with it right away. And you go back to med school, and nobody really knows about it. And 6 weeks later, you go to court, and the charges are dropped, and nothing changed in your life. You paid your rent, you didn't miss school or work. I'd say, and kind of you're broke. Your family can't support you in any way. You don't have any savings. You've got to come up with $500, but you can't. You're put into jail. Your trial it's a pretty quick one. It should be a week later, and it gets postponed. Something happens. It gets postponed again, and finally 6 weeks later, trial comes up. You're not guilty. Your charges are dropped. You're released, except you now have to repeat a whole semester at med school. You didn't pay rent and you were kicked out. And you were both equally guilty or equally innocent, but only the person who couldn't come up with a cash bond spent time in jail, and their life was dramatically impacted by that. The other thing, we said you've got to decriminalize substance abuse. We cannot put people in jail just for using drugs. Mm-hmm. The money you save by not incarcerating, if you save that money or use that space as a rehab unit or a mental health unit, this world might be a better place. So the two things I would have said that we would have changed were those two things: decriminalize substance abuse, eliminate cash bond. I would have been very proud if that had happened.
Mildred Williamson, social worker, HIV/AIDS section chief with the Illinois Department of Public Health, and executive director of HIV services at Cook County Hospital. Mildred's episode was titled Women Healing Women with HIV/AIDS.
We are now faced with a destruction of things we know that help preserve, if not save, people's lives. Destruction politically, economically, socially. This requires a movement for the right to be a part of, a respected part of the human family, regardless of your sexual orientation, race, or gender expression. It's not just enough to do your best taking care of the person who's in front of you with their health care. We have to do our best for that person, but we have to do our best within all of our ability collectively, because no individual is going to be sufficient to address the conditions that are unjust, unfair, and have been for quite a long time. That's how I feel. Those voices have to come from everywhere, and they all have to be respected.
Many thanks to our guests for sharing their words, but more importantly, their acts of service. Please email us your inspiring governmental healthcare or public health stories at info@inspiredtoheal.net. Follow Inspired to Heal through LinkedIn or your favorite podcast platform for future episodes and more information. Thank you for listening.
Inspired to Heal podcasts are for informational purposes only and should not be considered as health or professional advice. We are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast. The views expressed do not necessarily represent those of the host or the guest's current or past employers.